Hello, welcome to another video of this amazing channel. In this video you will find out all about gestational diabetes. Know now what gestational diabetes is, the main risk factors, symptoms, signs and important treatments. The risks of gestational diabetes are not few, but can be controlled with certain care. When I began to discover this same problem, I went through several difficulties to feed myself. Because everything I ate, the doctor said that my insulin control was too high, that it could increase my health risks if I continued to eat these kinds of foods. It was very difficult for me to begin to deal with this problem, because I needed to control all my food and everything that increases my blood sugar levels so as not to cause a snowball over the course of time. After having done several studies on diabetes, discover so many harms that this disease can cause in people that for a normal person, it is really scary to go through a problem and know that your arm or your leg can be amputated. One of the main harm diabetes can do to your body is increased blood glucose and high rates that can lead to complications in the heart, arteries, eyes, kidneys and nerves. In more severe cases, diabetes can lead to death. And today, thanks to the tip I'm about to give you, you've shown me the path I needed to take to get out of point A to point B in a very short period of time. Your luck of watching this video is that thanks to this content you do not I had to go through the same problems that I had to go through throughout my life to find a prevention for diabetes. Characterized by increased blood glucose levels during pregnancy, gestational diabetes can bring complications to the health of the woman and the baby. Among its developments are kidney damage and hypertension. Take advantage of the proximity of International Women's Day to meet him. The pregnant woman undergoes several hormonal changes over the 9 months of development of the fetus. The body starts to produce a greater amount of insulin, responsible for transporting glucose from food to cells. This happens with intensity in the last trimester of pregnancy, when the woman needs to ingest a greater amount of carbohydrate for the child to develop well. It turns out that other hormones released by the placenta hinder this process and force the pancreas, the gland that produces insulin, to work bent to keep the levels of the substance in order. Often, the effort is not enough and there is too much sugar in the bloodstream. It is gestational diabetes. The disease puts at risk the health of the baby, who now receives a lot of glucose through the placenta. The pancreas of the fetus ends up overloaded, even working at full throttle. There is not enough hormone to turn glucose into energy in your cells. Sugar scraps turn to fat, and the child gains weight beyond the count. In childbirth, when doctors cut the umbilical cord, the mother's sugar supply to the baby is stopped. As your pancreas has produced a lot of insulin, there is a risk of hypoglycemia, a sudden drop in the amount of glucose in your circulation. Excess hormone still hinders the absorption of calcium, potassium and magnesium. Gestational diabetes also increases the risk of premature birth and jaundice. Main signs and symptoms: constant seat, frequent urge to urinate, tiredness. Factors of risk: gestation at an advanced age, excessive weight gain during pregnancy, high blood pressure, high levels of triglycerides, high cholesterol, overweight or obesity. The treatment: gestational diabetes requires specific follow-up, with regular assessments of the glycemic curve. To keep sugar rates in order, the doctor recommends extra attention to diet. Meals should be fractionated throughout the day and patients need to ease off on fat. Fruits, vegetables and whole foods should be a constant presence on their menu. If there is no contraindication of the obstetrician, moderate physical exercises are allied to tame trouble. If your glucose levels continue to rise even in the face of so much care, your doctor may indicate insulin injections to balance hormone production and relieve your pancreas. In general, the problem ends right after delivery. For you who like this content and need to find a definitive solution, a suggestion only for those people who want and who can no longer endure this disorder that diabetes has been causing and need to find a correct formula once and for all. But for you to take your next step and find this correct formula, I will invite you to click on the link that will be in the description of this video. After you click on the site, you will be redirected to a page for another video with a super information that all diabetics need to know before any treatment. As this video progresses, there you will find the concrete solution of everything you discover that made me have a more pleasant and healthier life. You need to make that decision right now before it's too late. I'll see you in the next video.